May of 2015, the Pan American Health Organization issued an alert regarding the first confirmed Zika virus infection in Brazil. The outbreak in Brazil led to reports of pregnant women giving birth to babies with birth defect and poor pregnancy outcomes. In response, the CDC has issued travel notices for people traveling to regions in certain countries where Zika virus transmission is ongoing. This is kind of the important part. Zika virus is spread to people through mosquito bites. The most common symptoms of Zika virus are fever, rash, joint pain, and conjunctivitis, which is better known as red eyes. The illness is usually mild, with symptoms lasting from several days to a week. Severe disease requiring hospitalization is uncommon. So what's the Zika virus count? So as of yesterday, February 3rd, 2016, we had 10 cases of confirmed cases of Zika virus in Texas. 7 were in Harris County, 1 was in Bexar County, there in the San Antonio area, and 2 were in Dallas County. The CDC recommends pregnant women and any trimester should consider postponing travel to an area where Zika virus transmission is ongoing. If a pregnant woman is considering travel to one of these areas, she should talk to her healthcare provider. If she travels, she should strictly follow steps to avoid mosquito bites on the trip. It's good practice to protect yourself and your family from mosquito bites, even in Texas, and even if you're traveling to countries with active Zika virus infections, to protect yourself from mosquito bites. So that's the main thing, is protecting yourself from getting bitten by a mosquito. And the good news is right now in Texas, this is not mosquito season, it's winter, but mosquito season is coming.
It was first discovered in Uganda in 1947, but in May of 2015 it was discovered in Brazil. And it was the first local reported transmission of Zika in Brazil. And since that time, it's been linked to very serious birth defects, mainly microcephaly or babies born with abnormally small heads, and other birth defects there. Has there been a precise, exact causal link between Zika and microcephaly, the birth defects in Brazil? No, there hasn't. A lot of research is being done because of that, but in an abundance of caution, since now there are about 3,670 cases that are being investigated, World Health Organization, CDC, has made these travel recommendations related to that. The Brazilian Ministry of Health is researching this very feverishly and intensely and looking at that link between Zika and these birth defects. Mosquitoes that spread Zika virus bite both indoors and outdoors, but these particular species, the Aedes, A-E-D-E-S variety, bites mostly during the daytime. So one needs to protect himself, especially herself, if they're expecting an expectant mom throughout the day. In contrast to West Nile virus, which is the Culex species, C-U-L-E-X species of mosquito, this again is the Aedes. 2 species, Aedes aegypti and Aedes albopictus, which are just varieties of mosquitoes that in this particular case spread the Zika. And again, they are primarily daytime feeders. They come out in the day, they live in bodies of standing water and old flower pots, things like that, tires, and propagate, and then they feed their body. And they can also bite at night, it's usually during the day. Zika is again transmitted through the bite of this infected mosquito. These mosquitoes lay their eggs near standing water, buckets, bowls, dishes, flower pots, vases. And how a mosquito becomes infected is they feed on a person already infected with the Zika virus, and they can spread it then to another person. Health departments across East Texas are watching for reported cases. As George mentioned earlier, we have 10 cases now in the state. The case that made the news yesterday from the Texas Department of State Health Services was a sexually transmitted case there in the Dallas area, which is fairly rare from the research that I've done. But the health departments across East Texas are being real vigilant and watching returning travelers, and if they are identified as being diagnosed with Zika, then monitoring the transmission and conducting surveillance on those mosquitoes that would be in proximity to that individual.
It's important to realize that only about 80% of people who actually are infected with the virus actually become ill or symptomatic at all. So it's possible to be bitten by a mosquito carrying the virus, to become infected with the virus, and never know that that's actually happened. The common symptoms are fever, rash, joint pain, and some redness of the eyes that in the medical world we call conjunctivitis. So it's not really an infection of the eyes, but it's a kind of like bloodshot eyes and inflammation of the eyes. From a laboratory testing standpoint, there's not really a commercially available test for the virus. As it stands right now, most of the testing that's going on of blood specimens in particular is performed at the CDC, a special laboratory at the Centers for Disease Control. That testing is a kind of test, without getting into detail, that is kind of a molecular test called PCR. And it's a way to genetically fingerprint, if you will, the virus. One of the problems right now is that that test can be confused by other viruses. There's some cross-reactivity, and so it's hard to be absolutely certain that it's that virus and that virus alone. So a lot of work is going on presently related to that. There really is no drug treatment or medical treatment for Zika virus as it stands today. So what that means is that we treat these cases that really have pretty mild symptoms very supportively. So rest, fluids, maybe a little pain medication, like the over-the-counter kinds of pain medication for joint pain. Although there has been a little bit of a mention about whether or not people should use aspirin and what we call non-steroidal drugs like ibuprofen. There's not a lot known about that at this point, but obviously key things are supportive, so if those kinds of medications can be avoided, that's probably not a bad idea. There are no vaccines presently. Again, this is really, prevention really is the elements of prevention that should be emphasized really are, in fact, the prevention of mosquito bites. People, if they are infected with the virus, they have something we call viremia, which means that the live virus is actually circulating in the bloodstream. And so you may get symptoms with that. Usually they're recognized to be viremic for a period of maybe 3 to 7 days to about a week. Again, there's not a lot that we know about this at this point. But what that means is when you're coming back from an area where you may have sustained a mosquito bite and become viremic, that if you come back here to, let's say, the U.S., you have, and this may sound strange, but you have a risk of infecting the mosquito population. And from a public health perspective, then propagating the disease. So that mosquito now transmits the virus to another person here.